With the primary election tomorrow, a lot of voters are saying that health care access and affordability both on the ballot. We've talked about hospital closures here on the show. We've talked about worker shortages, lack of resources. Joe Ripley's been doing a lot of reporting on this and has a look at what the state's already done when it comes to some of this.
And make no mistake about this, Dan, the state of Georgia has made major strides when it comes to making health care more accessible, more affordable. Still, though, there are plenty of gaps that need to be addressed, and it could mean life and death for many patients.
Juliana Ferrone will never forget the day in July 2020 she felt the bloating, back pain, and abnormal bleeding. The day that changed her life forever.
I was 27 years old when I got the news that I had cervical cancer.
A gut punch for the Conyers native who lived in Opelika, Alabama at the time, drove 70 miles one way for care, and then moved to LaGrange to get closer to the City of Hope Cancer Center to get treatment.
Where you live should not affect whether you live or not. It's extremely frustrating when you spend so much time looking for treatment because when you're sick, you don't have the energy to do so.
Natasha Taylor, Deputy Director of Georgia Watch, says a lack of access to health care continues to plague the state.
There's already an issue in rural Georgia with provider shortages, hospital closures, transportation, getting to care. So now you're talking about I can't even afford care as it is.
Taylor says Georgia lawmakers have made strides, such as creating more residency slots, plus an easier path for internationally trained doctors to get their license here, limiting use of artificial intelligence in insurance coverage decisions, and preventing surprise ambulance billing. Taylor says she'd like to see more transparency in healthcare pricing and certification of community healthcare workers to address the provider shortage.
They have to make a choice between paying their rent or paying to put food on the table and paying for health coverage.
After 27 rounds of radiation every 21 days for over 3 years, Juliana Ferrone now advocates for early screenings, along with accessible, affordable, and preventative health care.
We're literally talking life and death here. You know your body. You know when something's not right. And when you get such a earth-shattering diagnosis like that, you got to be proactive and advocate for yourself and your health.
So to further address access to health care, state lawmakers have also expanded the maternal home visiting program to more than 30 counties statewide, as well as they've added funding for Medicaid reimbursement rates for primary care, dental care, and nursing homes.
Hey, look, it's a big issue in this country, and I don't know what the solution is, but it's not necessarily unique to Georgia either.
No.
And I think it's going to be on the ballot in a lot of states come November.
Yeah, I think we make a lot about affordability being on the ballot, voters being frustrated. Obviously, inflation is a concern. Obviously, gas prices, you see those every day. But when you're struggling with your health, like Juliana said, it's a wonder she was even able to get help. For her, she decided that I might as well move because driving 70 miles one way was not going to cut it. She had that luxury. She had that option to move. A lot of folks do not. They live in rural communities and they've seen their hospitals close. They've seen doctors move away. And so they are struggling not only with their health, with their families as well. This is a generational issue, and it's not going to take one election to fix it, if I might opine.
No, I think you make a good point there. Joe Ripley, thank you very much, sir.